Hello, I'm Dr. Ruth Roberts. I hope you are well today. We have several questions from you all that I will get answered for you. So let me pop back over to the Facebook page because that seems to be the easiest way to do this. So let's see here. There we go. So if you missed it last week, I added a link where you can get access to Standard Process products. All you have to do is go to their Patient Direct website, pop that code in, and ask to set up an account, and then when you do that, we will review it and then add it. I think Standard Process offers a lot of interesting products that really you cannot find anywhere else. The one thing I will tell you is that the whole body support and unfortunately both the dog and the cat are not set up to be supplements that are balanced for feeding pets, home cooked food and that sort of stuff. So that just keep in mind, it's not a bad option for short term. Again, if you are almost out of holistic total body support, we have some jars of the cat product left. I can't sell them to you, but if you will pay for shipping, we're happy to send those over. And if you just email Baruz at Dr. Ruth Roberts at drruthroberts.com, he will send you an invoice. We're, as is kind of common with everything, had hoped for a March 1st shipping date. Looks like that's going to be probably March 15th. But we should get that going here pretty quick to have holistic total body support back in stock. And again, that's going to be much easier for you as far as it's a larger volume, less expensive, that kind of stuff. So Dorian's asking about her 3-year-old chow. So she's just had a wellness check and blood work, fecal and urine and all that good stuff. Blood work showed everything was good, urinalysis was good except for the specific gravity, and the reading was 1022 after 11 hours of no water. So her vet's saying, oh my God, your dog has the early stages of kidney failure, and the other holistic vets are saying not so much. Now, here's what's going on. Don't go with a low protein diet. So if you are feeding crock pet food, you are feeding water whenever your pet eats. And so what's important to remember is that even though your pet's been fasting for almost 12 hours, that is different because she's starting with a bigger base point of hydration. When I first started in practice in 1990, 1020 to 1035 was considered a normal urine-specific gravity, and now it's 1045 to 1050, and that is because everybody is feeding dry food, and dry food dehydrates them. If you're not seeing any issues as far as increased urination, things of that nature, I don't think I'd worry about it too much. What I would do is take a couple of samples first thing in the morning, which is probably what you did, and just check that they're consistent. As long as nothing else is going on, you're not seeing protein in the urine, anything of that nature, it should not be a problem. So that's what I've got. Make sure the protein level is checked. As April points out, SDMA can be helpful, but the other thing is that if there is any other inflammation, which it sounds like it would not be present, then that will be positive. So it's not always indicative of kidney failure or kidney disease. The other thing that's interesting is that the bottom end of the normal range for SDMA has gone from 14 when the test was first launched to 18. And I think what happened is that IDEX and the powers that be realized that the value was just too low, and all of a sudden we're throwing all these animals into kidney failure, just like when the American Heart Association changed the blood pressure normals last year to something substantially lower, and all of a sudden 50% of Americans were hypertensive instead of 25%. So take all of that with a grain of salt. If everything looks good to you, I wouldn't worry about it. Mona has had a urine-specific gravity of 1022 for about somewhere in that 1020 to 1027 range for about 6 years now, so not a worry. Now, April's asking about the medication for reflux that's on the store in line, and let me pop over there and show you what she's talking about. And that's Heartburn TX powder. The thing that is really super about this product is it's designed on the human side to help with acid reflux, and I think it does a great deal with that. But the other thing is that the reason I have it on the site is it is a fantastic gut healer. So all of these things, zinc, L-glutamine in specific, glycine, N-acetylglucosamine, deglycerized licorice, and aloe vera are outstanding at helping to heal the gut and helping to seal a leaky gut over. So the dosing is going to be somewhere around, so if the full human dose is a teaspoon, for a 50-pound dog, I'd use a half a teaspoon twice a day. But that's been a really wonderful product for many, many pets. So if you're not familiar with it, go check it out. It really has been a home run for so many pets. And personally, I used it too to help get through some of my GI issues. So that's where I would start with, April. Hope that's helpful, and I think it would help. And there's a whole ton of, like Terry's talking about, using apple cider vinegar, and I think you can try it. And this is the conundrum about acid reflux. What tends to happen is the acid isn't in the stomach when the food is. It tends to arrive after the food is left, and hence the reflux. And then the other thing is, too, in Chinese medicine, that's considered to be rebellious qi, so things are coming back up rather than staying down, so to speak. Susan is asking about her Shorkie with an elevated ALT. And Susan, I think, there's a lot of options you can pull from, and one is the liver support page. I think that's a great place to go. If you can afford a consultation, that's great. If you can't, then that's where I would start. So each of these cases are different, but with an ALT of 324, if that's new, if the ultrasound shows you gallbladder sludge, I would not be surprised, and I frankly would talk with your vet about ursodiol to help get that moving, and then work on other things that support the liver. So things like milk thistle, as mentioned below, and also liposomal glutathione is like the master antioxidant for the liver, and so that's been an enormous help for a lot of folks. Sita's had great response with that, and then Denise has as well. So go check it out. I know consults aren't for everybody, but that's to get down to the really nitty-gritty details for each specific patient. It takes me time to review medical records, so I think that's the best way to go. Is if you can, book a consult. If you can't, go check out the liver support protocol. And I'll bet you dollars to donuts that there is gallbladder sludge. So Sita's asking about the 22-quart roasters. How long does it take on low, medium, or high? I think you want to go for high. Sometimes it's 250, or you can set it to a specific temperature, and 250 to 275 is what we used to use. So I would go for that. If I remember correctly, it took me about 6 to 8 hours, kind of depending on what we were starting from, if we had frozen veggies or not. So hope that's helpful. How exciting and fun, Sita. Chris is asking about her Yorkie that's 2 pounds, and she's lost all of her teeth to periodontal disease. So I think that where you want to go with this little baby, because she is so tiny, and a quarter of a cup of food is actually going to be a large volume, is to start with adding a little bit of fat if she's never had issues with pancreatitis. So you can start with literally 1/8 of a teaspoon and work up to something like 1/2 a teaspoon per meal, because that's going to be your most concentrated source of calories without adding volume to the stool. The other thing you could do too, if that's not working or she's intolerant to fat, is to actually cut the volume of vegetables down somewhat. So there's a total of 7 cups of veggies in the recipe, and so what I would suggest is go to 1 cup of brassicas and then 2 cups of brassicas and then 3 cups of the other veggies. The other thing you can do to kind of condense the nutrition is to take the beans out and use one of the no bean recipes with an extra 1/2 pound of protein, whatever protein you're using. So I hope that is helpful. I think that's going to be a really awesome way to get more food into her more easily. And it's been such a boon for pets to be able to eat this home-cooked food pretty quickly. So that is what I have for you all this week. Didn't have too many questions. So again, if there's something I can do to be of help, please don't hesitate to ask here. Let me just double check the sheet that Ruth had sent over for the other questions, and I think we got all of those covered today as well. So until next week, remember, your pet's best health starts in the bowl. Take good care. I'm Dr. Ruth Roberts, your pet's ally.